Today I will talk about hospital-acquired infections. This is part of my series of lectures on hospital management. This is my lecture outline. First, I will define hospital-acquired infection. Then I will talk about consequences of hospital-acquired infections, then type of hospital-acquired infections, high-risk areas, then epidemiology of HAI, organization of HAI prevention, infection control practices, antibiotic policies, surveillance of hospital-acquired infections and prevention, matrices and KPIs. So an infection acquired by a patient who was admitted for a reason other than that infection is hospital-acquired infection. In other words, an infection occurring in patients in a hospital or other healthcare facility in whom the infection was not present or incubating at the time of admission. This include infections acquired in the hospital but presenting after discharge, and also occupational infections among healthcare workers. Sources of infection may be either exogenous or endogenous. Exogenous include from other patients, from staff, from visitors. What are the consequences of hospital-acquired infections? There is increased morbidity and mortality due to HAI. There is emotional stress and functional disability due to HAI. There is prolonged hospital stay of patients. There is increase in bed occupancy, that is pressure on hospital resources. There is adverse effect on hospital performance. There is also adverse effect on hospital image, and there is increase in healthcare cost. Hospital-acquired infections include urinary tract infections, this is most common, respiratory tract infection, surgical site infection, vascular catheter infection, and septicemia. High-risk areas of the hospital include nurseries, intensive care unit, dialysis unit, burn ward, cancer ward, operation theatre and post-operation ward, labor room and postnatal care ward, and organ transplant unit, among others. Epidemiology of hospital-acquired infection. So in epidemiology, there is a role of microorganism, there is role of host factors, and there is role of environment. So let us see. Microbes in hospital-acquired infection may be either bacteria, most commonly gram-positive bacteria, and also commonly gram-negative, then viruses and fungus. So organisms in hospital environment are usually resistant to most antibiotics. So this is worrisome feature of hospital-acquired infection. Hosts include either patient or healthcare worker. And as far as patients are concerned, hosts are usually susceptible due to either extremes of age, due to either primary ailments like diabetes mellitus, cancers, burns, and nephritis, and other systemic diseases, due to therapeutic practices like chemotherapy, radiotherapy, and due to complicated diagnostic procedures like cardiac catheterization. So these are the causes of increased susceptibility of host. Then environment reservoir includes permanent or transient flora on patient or healthcare worker. So the source may be healthcare worker or patient, and it may be permanent or transient flora. Then transmission is either by direct contact or airborne or through hands and objects. So there are certain environmental places or environmental objects where there may be reservoir of infections. So like wet and damp area of hospital may harbor pseudomonas. Then lining may be the source of bacteria, equipment may be the source of bacteria, even food served in the hospital may be source of infection. So what is the organization for hospital-acquired infection prevention? So there is a Hospital Infection Control Committee or HICC, include management representative with authority, and usually it is medical superintendent. It include physicians, it include microbiologists, it include other healthcare worker, including infection control nurse. This is very important position with critical role in infection control. Then pharmacist, who has a role in preparation of antibiotic policy. Then central sterile store department in charge. Then housekeeping in charge. So this is about members of hospital infection control committee. Then infection control tasks include promotion of health of workers, appropriate isolation of patients, control of sterilization, disinfection and cleaning procedures, staff training, epidemiological surveillance. I'll talk about surveillance later. Then outbreak investigation. This is also important task of infection control. Then infection control practices include either universal precautions or specific precautions. Universal precautions are followed every time by healthcare worker while treating patient, and this include hand washing, use of gloves, and not misuse of gloves. Then use of mask, use of protective eye shield or face shield, use of gowns or aprons, and guidelines for good work practice. By misuse of gloves, I mean that contaminated gloves should not be used to handle other objects or other patients. Then specific precautions include airborne precautions. These include universal precautions, as I have told you in my previous slide. Then there should be single room per patient with negative pressure because it is airborne infection. Then healthcare worker and visitor must wear uh, N95 mask. Then there should be limit in movement and transport of patients, and we should place mask on patient if transport is required. As far as contact precautions include, it include universal precautions, single room per patient, healthcare worker and visitor must wear gloves, and there should be limit in movement and transport of patients. Then thorough knowledge and strict practice of sterilization, disinfection, and cleaning practices is required to prevent hospital-acquired infection. Their antibiotic policy. It is drafted by Hospital Infection Control Committee or Hospital Antibiotic Committee. So Hospital Antibiotic Committee is actually subcommittee of Hospital Infection Control Committee. Antibiotic policy is an evidence-based antimicrobial treatment guideline. It is framed on the basis of existing microbacterial flora and their resistance pattern to antibiotics. The antibiotics are rotated as per new evidences. So antibiotic policy advantages include it helps in prevention of antibiotic resistance. It controls the spread of infection. It also saves money. Antibiotics as per antibiotic policy are divided into unrestricted antibiotics, restricted antibiotics to be used only in defined situations and by an authorized person, and excluded antibiotics. Then hospital antibiotic committee composition include microbiologists, pharmacists, clinicians, and nurses, and task is formation and dissemination of hospital antibiotic policy. Then surveillance. Surveillance is the ongoing systematic collection, analysis, interpretation, and evaluation of data, closely integrated with the timely dissemination of these data to those who need it. This is the definition of surveillance. Surveillance of hospital-acquired infection cases may be either active surveillance or passive surveillance. This is surveillance of cases. We can also do surveillance of environment. So surveillance of environment is either done by swab method or by settle plate method. In swab method, sterile swabs soaked in nutrient broth were used to sample collection from different sites and equipments, and this include instrument trolley, tabletop, lights, monitor, walls, floor of an operation theater or wards. And the swabs are labeled properly and transported immediately to microbiology laboratory for inoculation on blood agar and McConkey agar. Then settle plate method include blood agar plates labeled with sample number, theater site, time and date of sample collection, kept at about 1 meter above ground, 1 meter from wall, and exposed for 1 hour when the OTs are functional. The plates are then incubated at 37 degrees centigrade for 24 hours, observed for growth and number of colonies. The colony forming unit that is CFU count per plate, was expressed as CFU per meter score by this formula. Then matrices and KPI of hospital-acquired infection prevention. These include percentage compliance of hospital staff with the WHO 5 movements of hand hygiene. Next include rate of new cases of hospital-acquired Staphylococcus aureus bloodstream infection, rate of new cases of hospital-acquired C. difficile infection, rate of carbapenemase producing enterobacterials, that is colonization and infection, rate of meropenem use and use of other critical antimicrobial agents, rate of surgical site infection, rate of ventilator associated pneumonia. So this is all for today. Thank you very much.